taking Tylenol is not good. But don't take it. If you're pregnant, don't take Tylenol. And don't give it to the baby after the baby is born. Don't take Tylenol. Fight like hell not to take it.
Does it, Tara, have any political impact for the president when some of the people closest to him are distancing themselves on this issue?
Yeah, what we saw was an irresponsible, reckless display of medical quackery by the president of the United States, who has absolutely no expertise in this area whatsoever. Not only does he not have expertise, but he's spreading misinformation that could be dangerous for women and for women who are pregnant and their babies. You know, millions of women take Tylenol during their pregnancies because it has been deemed safe to do so. And to make a false link like this, it is in line with the agenda that they've had that is an assault on women's health, assault on women's reproductive health, and it's not going to stop here. They're also trying to push for banning mifepristone, which would deny millions of women safe abortion care and safe care for miscarriages. So again, the concern here politically is when, as women see this and they see the way that Republicans are handling it, it is a threat to our lives and our health, and it can backfire on them, and it should. They should be listening to their doctors and people who are trusted voices, not medical quackery coming from Donald Trump and his conflicted cabinet, who know absolutely nothing about what they're talking about and spreading misinformation.
Barack Obama picks and chooses very carefully when to jump into the political fray. Why do you think he chose this?
I think that as a girl dad, right, he probably sees that, you know, he has daughters that may have children, you know, one day, and doesn't want our American health system being co-opted by people who are spreading lies that are not based on real, legitimate science. So I'm glad that he's using his position and his voice because it's powerful and it matters. And I think that for a lot of American women, they don't want to be lectured by a bunch of men in an administration that the current administration telling them to tough it out. Coming from, you know, Donald Trump, who can't even take a joke. You want to talk about tough it out, telling women to just tough it out and then, you know, cause more anxiety, to Dr. Gupta's point about pregnancy. It's tough enough for women in this country. So I'm glad to see Barack Obama coming out, speaking out. We need to see more of that and more of and where are the women? Where are the women elected officials? Where are they, particularly Republican women who know better? We should be hearing from them calling this out. I'm glad to see Senator Thune was willing to call out Donald Trump on this, but he won't definitively say that Trump can't run for a third term. So we need to be very cautious of the messengers and who's lecturing women about what they should be doing with their bodies.
In the last election, Donald Trump's election was driven by men, particularly young men. And now we're seeing this gender gap growing. Should all Republicans who are going to come up for re-election in a way that he is not be worried about this right now?
Of course. This is why Republicans are trying to rig the midterm elections with, you know, mid-decade redistricting. They know that they are in trouble because a lot of the promises that Donald Trump made to the American people, he's not fulfilling them on economics, on all these other things to improve people's lives. He's betrayed the American people to line his own pockets and to do favors for his billionaire buddies, which make up the majority of his cabinet. And he's fixated on a retribution tour. So Republicans who are running for re-election in the midterms are trying to figure out how to navigate this. Unfortunately, a lot of Republicans are tripping over themselves to see who can suck up to the president more and be more MAGA than they are pushing policies that actually help the American people. And for women in this country, the effects of the betrayal bill that got passed on our health care, on our access to health care, rural hospitals, childhood cancer, all of these things are being impacted by Donald Trump in ways that really are difficult for the American people, particularly women who are often the heads of households and making the healthcare decisions. So sure, Republicans have to try to figure out how to navigate this, and women should and are, as you see in this polling, coming out and speaking up and saying, wait a minute, this is not what we voted for, and they should pay the price at the ballot box for it.